Should I get the flu shot while on prednisone? Hi, I'm Dr. Megan, your prednisone pharmacist, and this is a great question because prednisone is causing immunosuppression. So, should you take a vaccine that also is affecting your immune system? It's kind of confusing. So, full disclosure, I gave over 200 flu shots in one day. I'm a pharmacist and I was a certified immunizer for a long time. And so this is important to know. Should I have given that shot if somebody was taking prednisone? Here are the factors to consider. So first of all, there are two types of flu vaccines. There's the nasal spray, it's called Flu Mist, and it's a live vaccine. And then there's the injectable kind that usually goes right here on your arm. And that is inactivated. It is not a live vaccine. And those distinctions matter because the live vaccine is not recommended while you're on prednisone. Instead, the injectable kind is what you should get. So going to the pharmacy and getting the live vaccine while on prednisone is just fine. But there's other factors to consider, such as your dose. Your dose of prednisone is really important. According to the CDC, if you are taking 20 milligrams and above for 14 days or longer, then you are considered substantially immunosuppressed. And the vaccine just might not work very well for you. And so they have different guidances for people who are taking different doses for different lengths of time. So if you're going to be taking prednisone for less than 2 weeks, then you need to wait 2 weeks after your last dose. If you're going to be taking prednisone a long time at a lowish sort of dose, then just get the vaccine. It might not work quite as well for you, but you'll have enough of an immune response to get it. Should you get the high dose flu vaccine? The high dose flu vaccine is designed for people who are 65 and up. So if that's you, then I definitely recommend getting the high dose flu vaccine. There's other nuances like should you get a second dose or things like that. You should definitely talk to your doctor about because that's really specific to your health and your situation, your age, and other things. But when is the best time to get a flu shot? The best time to get a flu shot is sometime either in September or October. I prefer to get my flu shot the first week of October because that means I will get 6 months of protection. Since the flu season can go anywhere from September to April or May, you'd want coverage that whole time period. If you get the flu shot back in July or August, it's going to wear off by February, which is often the peak of the flu season. And so you want to get it to give you the most immune coverage during the peak of the immune system. So that's why I get it in October. Other questions like, can you get the flu shot and the COVID shot at the same time? And yes, you can get them at the same time. I have a whole video all about the timing of flu and COVID vaccines, if you'd want to watch that for more details. And some myths I'd like to bust about the flu vaccine. Does the flu shot give you the flu? No. As many of us learned who had to get our COVID shots, that getting the COVID shot caused you to have a robust immune response that felt awful, that was almost as bad as the infection with COVID itself, right? You might have gotten a fever, you might have gotten aches, chills, pains, and on and on. And so if that was you with the COVID shot, it might happen with the flu shot too. That is not the shot giving you the flu. It is simply your body having an immune response. Your body got this foreign invader having antibodies and release of cytokines and other things. And so you need to realize that that's not the flu. That's your immune system's response to the vaccine. And that's a good sign that you're having an immune response, even though it doesn't feel so good. So am I personally getting the flu shot? Yes. Last year, I got sick at the beginning of October. And so I kept waiting to get better and waiting to get better. And I never got better long enough to get the flu shot. And then I got hit with influenza A at Christmas. It was horrible. And the influenza A became a sinus infection too. I was miserable when it's supposed to be the happiest time of the year. I have 5 little kids and I wanted to be totally present and happy in being with them. But instead, I was stuck on the couch. I felt horrible. And so I am definitely getting the flu shot this year. I do not want to go there again. I don't want to be stuck like doing breathing treatments instead of enjoying my family when I should be enjoying my family. So get your flu shot. And if you have any questions about how to deal with those flu vaccine side effects, click the link below and I will send you my vaccine side effect coping tips so that you can have your best experience coping with the vaccine side effects. Signing off as Dr. Megan, your prednisone pharmacist.